Hello, so excited. This is the final journal assignment, and I'm completing this course as well as the program. For the questions to address for this final reflective video, what goals did you set for yourself at the beginning of the semester, and did you meet these? Yes, most of my goals have been the same for every class, and that is always to build a good rapport with patients so that they're better able to speak on exactly what their issues and their concerns are so they can better be treated. And a number one goal I've always had as well is to learn as much as I can about medication. Because if we're prescribing these medications and we're doing these prescriptions for these patients, we have to understand what we're doing because every patient is different. Every patient's metabolism is different. Every patient's family history is different. They also have medications that they're prescribed based on what has been effective for their family members in the past. So it's always very important to understand the medication. I do feel like that goal has been met, but I feel like it will be met, of course, better when I'm actually out there in the field working and learning from, my fellow PMH and Ps and being able to get more orientation as I start on my next journey. What feeling, prejudices, and biases did you experience? I didn't really have too many. My number one bias I've always really had with mental health is working with patients who have been sexually abusive to children because of my past, because I did experience a family member who had been kidnapped and raped when we were kids. So that is one of the biggest probably prejudices that I do have, but I do know that I have to be professional and conduct myself, in a professional manner with those patients, just like other patients, and I plan to do so. Thankfully, with this current clinical experience, I didn't have to work with any of those patients, but I do on a day-to-day basis at my job that I work. I work at a acute care hospital, so I do see those patients on a daily basis. So I've learned to be able to work professionally with them, but that is my probably number one bias in mental health. How do you manage your anxiety, self-doubt, or uncertainty? I would say education. If I feel that I am uncertain about something or I'm doubting something, I'm always the person that's going to always ask questions. It's never going to hurt you to ask. It's better to ask the question than to make the wrong decision or do something inappropriate for somebody's plan of care. So that is how I manage any self-doubt or uncertainties that I have. Anxiety, I don't think there's never really a way where you can say you'll never have anxiety. At some point in our lives, we're going to all deal with some type of anxiety. I kind of deal with mine by just, trying to put myself in a positive mind frame and remember that nobody knows everything. And we're all learning every day, no matter what our profession is. And that's kind of how I deal with my anxiety in life. How did you manage your anxiety? I'm sorry. I did that one already. What understanding or insights did you develop during your clinical experience? Like what one of my goals was, building a good rapport with your patients. The nurse practitioner that I do my clinicals with, I absolutely love her. She talks to her patients like she knows them all on a personal level, and I know she don't. A lot of them she meet, of course, there, and then a lot of people have been referred to her because she has children that go to school with a lot of kids that she see. Of course, she's professional, and she wouldn't discuss anything with her children, but I just feel that when she talks to her patients, she's talking to them like she knows them versus just being a nurse practitioner, just being their medical provider. She, what's going on with you? How you feeling? Okay, so what do we need to do? So, and it's different for every patient. She learns the patient first, and then she brings that personality in during her assessments with that patient that best fits the patient. So I felt like that was a wonderful insight that I will plan to develop myself with my patients in the future, because if your patients are comfortable with you, they're more open with you, and you're better able to help them. Has reflective practice impacted you as a person, student, or provider? Yes, because every time I do these videos, it reminds me of something that was important or stood out to me that I didn't realize did. So once I'm able to actually answer the questions from the video, I'm like, okay, sometimes you don't even understand how something impacts you until you think about it. So reminding myself of how I use myself during these assessments and reminding myself of how I want to be the best at what I plan to do in the future, it just gives me more insight to go that next week and learn more and try to figure out more to come and say in these videos the next week. And because I know I have to report with these videos, I know I have to give my undivided attention during each of the assessments so that I'm able to provide some information for my journal assignment. Will you continue to use reflection in your future practice? Yes. I want to continue to use this in my future practice. I hope to one day have my own private practice with adolescents. That is my ultimate dream. I love working with kids. I've been working with the kids ever since I got into psych about 5 years ago. I work with adults as well, but there's nothing like working with the kids, because I feel that they are special because they are the future. So if we can help them to better their minds when they're young, and we have the opportunity to do that for them. Of course, in the nursing role, it was more about nurturing. And a lot of it was, of course, giving the medication versus prescribing the medication. The new role that I am transitioning into is more, I believe, a little bit more therapeutic than just being a registered nurse with these kids, because I am able to actually help shape their future by making sure that their goals are met with not only medication, but being able to provide, different type of suggestions for therapy for them, different things for them to do at home, different suggestions for them to do in their life. That's something that I noticed that the nurse practitioner, she did a lot too, that I really appreciated when she worked with her patients. A lot of the kids, it wasn't just always about education. It wasn't always about therapy and medication. It was also about just her considering their everyday life and some things that they could do, and just giving them some suggestions to better themselves and helping them to do research to better themselves. And I feel like a lot of the times they would come back for their follow-up visit, and after doing some of the things she suggested, they would be in a better mental space, and all of that matters. So reflective practice, I feel, helps you to look back over the things that you have done, so you can also decide some changes that you can make for the future, because tomorrow can always be better, but looking at tomorrow, looking at yesterday, you can make tomorrow better. So I do plan to use reflective practice in my future, and this is why. And that wraps it up. I want to thank you so much for being my instructor. I learned a lot. I really enjoy every seminar. I feel like they were very beneficial. They were very educational. Even simple things like doing the questions, the review questions, I enjoyed those as well. And it kind of brought to light some of the areas that I felt like I needed to review a little bit more to prepare myself for my boards. And like I said, thank you so much. Everything was great, and I can't wait to transition into the role so I can be where you are in life. Thank you.